New numbers shed disturbing light on teens and smoking.
And there have been more cases of the measles confirmed in the United States. Health reporter Haley Hernandez has health headlines today.
Hey, good morning, guys. So the CDC released new numbers showing there are now 101 confirmed cases of measles in 10 states this year. More than half of those are in Washington state. The Centers for Disease Control and Prevention linked the Washington state outbreak to a strain from Eastern Europe after travelers returned from Ukraine with the illness. But as we've been telling you since last week, 7 cases are here. That number includes 3 in Harris County and 1 in Montgomery County, 1 in Galveston County as well. New numbers will likely go up when the CDC issues its weekly update of affected states later this week, so we'll be sure to tell you what those are. The soaring popularity of e-cigarettes is undoing years of progress in youth tobacco control efforts. The CDC blames electronic cigarettes for an increase in teen tobacco use. 4.9 million middle and high school students use some form of tobacco now, up from 3.6 million just 2 years ago. This new CDC report finds many teenagers are smoking both e-cigarettes and regular cigarettes. The Food and Drug Administration has threatened to ban flavored e-cigarettes unless manufacturers come up with a solid plan to keep them out of kids' hands. The keto diet has become one of the most popular diets in recent years, but it doesn't work for everyone. It was originally developed in the 1920s as a medical treatment for children with seizures. The diet calls for consuming high amounts of fat, a moderate amount of protein, and a very limited amount of carbohydrates. But according to Ann Louise Gittleman, author of Radical Metabolism, if you've got type 1 diabetes and are insulin dependent, a keto diet could lower your blood sugar levels to dangerous levels. Also, if you have a history of eating disorders, going on a strict diet that eliminates food groups could trigger a relapse. And in people with thyroid disease, the keto diet could suppress levels of thyroid hormones. And also people with multiple sclerosis, the diet could have side effects like fatigue and constipation. And continuing our Loving Your Age series, I'm taking a look at how relationships change after 50. Ahead at 6:40, how to embrace relationships with your kids, your spouse, and maybe if you're starting to date again, how you maybe have the leg up.
Really?
All right.
All right, Haley, very interesting.
We're ready for all those. Thanks a lot.